Hi, I'm Dr. Beth Kasanoff-Piper, President of the Dallas County Medical Society. As many doctors suspected would happen, we're seeing decreasing numbers in infections in places where most residents are vaccinated and increasing numbers in places where people are not. Also, states with lower vaccination rates have significantly higher numbers of patients being hospitalized with COVID. In states where vaccination is not equal across the entire state, we're even seeing that same trend at the county level. Counties with high vaccination rates have low risk of COVID and the numbers are going down. But in counties where few people are vaccinated, the numbers are higher and the number of cases are growing. This is in part due to the new variants that we're seeing, but also because many unvaccinated people are feeling a false sense of security and abandoning masking and distancing. So I encourage you, if you are not vaccinated, please get vaccinated, but also please continue to wear your mask and distance to keep yourself safe. Some scientists think that without the variants, this pandemic would be essentially over by now. But unfortunately, the more people infected with COVID, the more variants will appear. The Delta variant, which is also known as the Indian variant, is the predominant strain in the United Kingdom right now and is associated with almost double the risk of hospitalization compared to the Alpha variant, which is the dominant strain in the United States currently. It also appears to be more transmissible, and the proportion of Delta cases is doubling every 2 weeks. The Delta variant accounts for about 6% of the United States cases right now. And thankfully, the vaccinations are very protective against this variant after receiving 2 doses. There's not much protection against this Delta variant, though, after only 1 dose, only about 33%. So if you're someone who's gotten that first one and hasn't gotten around to getting the second one yet, please go get it. Now is the time to do it. If your kids are between the ages of 12 and 15, they can now be vaccinated as well. Uptake in this patient population is slow, though, and there is reason for concern in our adolescents. Data from the first half of 2021 shows that about 1/3 of adolescents who are sick enough to need hospitalization from COVID-19 require admission to the intensive care unit, and 5% of those patients have died. We're also seeing a much longer recovery period for adolescents, even if the illness initially is very mild. And some of those things can include long-term symptoms like shortness of breath, decreased exercise tolerance, decreased ability to participate in sports, mood disturbances such as anxiety and depression, and pretty significant fatigue, which can last for months. So adolescents need to be protected for their summer activities, camps, sports, and certainly for the school year in the fall. So if your child is old enough to qualify for the vaccine, please get them vaccinated. Thank you.